Staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? But purple angel, purple angel, purple angel, you're next to me.
Well, hi everyone, and welcome to Alzheimer Speaks Radio. Today we're going to be doing a video interview, which I'm really excited about, and I will introduce our guest here shortly, but we are always getting new listeners, so I always like to give people a little background about us. And my name is Lori La Bey. My mom had dementia for 30 years, so I get the walk, I get the talk, I get the frustration, and I get the joy on this path. And due to my mom's dementia and my journey with her, I decided to switch careers and create a company called Alzheimer Speaks. And Alzheimer Speaks is really a platform to raise everyone's voice. So really, we're an advocacy-based company that just really wants to shift our dementia care culture from crisis to comfort all around the world, and to get these support services, products, and tools out to people in need, because that's what we really felt as a family that we were missing. We also help companies with their brand footprint, because we don't think it makes a lot of sense for everyone to kind of recreate things, but we believe really strongly in sharing and lifting one another up. And we couldn't do that without our loyal listeners like you. You guys have been absolutely fantastic. Your likes, your clicks, your shares, you might not think means a lot or does a lot, but it puts miles on the internet. When you push out our content, you don't always know who in that sphere, if it's your Facebook friends, if it's your Twitter tribe, if it's your LinkedIn colleagues, who's dealing with dementia, because a lot of people don't talk about it. And so the more information we can get out to them and make them feel comfortable and normal in grabbing it, the easier it's going to make their life. And so again, I just really, really appreciate your help with your likes, your clicks, and your shares. It really is important. That collaboration is massive, massive support. So thank you. You can all find more information out about us by going to alzheimerspeaks.com as well. There you'll find our different projects and initiatives, from dementia-friendly communities to memory cafes and so much more. Now, let me introduce our guest today, because I'm really excited to have her with us. We've got Lakeland Hogan with us, and she's a gerontologist and a caregiver advocate for home instead senior care. Lakeland works to educate professionals, families, and communities on issues that face older adults. And she has a special passion for helping people navigate the challenges of dementia, caregiving, and connecting them to valuable resources, which we all need. She has her MBA and her MA in social gerontology, and she is currently a doctoral candidate for a program at the University of Nebraska, Omaha. So congratulations, Lakeland.
Thank you so much. It's such an honor to be here. I'm so excited to be part of today's show. I've listened to your show, and I know the great work that you're doing, and so I'm just honored to be here today and to talk more with you about Alzheimer's and dementia caregiving, which we know, as you mentioned, can be challenging at times. It's kind of that roller coaster of emotions and experiences, and the more that you know as a caregiver, the more you can be empowered to care, and the more resources you can have access to, with the more outlets that you have for resources. So just very excited to be here and to share today.
Well, thank you. One of the questions I always ask our guests, and I hope you don't mind this, is, have you been personally touched by dementia in your circle of family or friends?
I have, and it actually was when I was a really young little girl. One of my great-grandmothers had dementia, and at that time, that's what it was just referred to as, was dementia. And so I have a few very distinct memories from when I was little. There was a time we were all at church, and my mom said, go give great grandma a hug goodbye. And so I, of course, did what my mom says to do. And so I gave her a hug, and she said, "Oh, that's nice, little girl. Who are you?" And I looked at my mom and thought, how does she not know who I am? And that has really, really stuck with me through my adulthood. And, you know, great grandma had wonderful care, fortunately, but you know, that is something that our family dealt with on one side of the family. So I have been touched by it in a personal way, but also I work with so many family caregivers in my profession, some of which feel like family to me, the clients that I have served over the years. And so I've seen it from multiple perspectives.
Interesting, you mentioned that story. I had a similar situation with a great aunt who was in a nursing home who one day didn't know who I was. And I remember it distinctly. I was 13 years old and I was devastated. I just thought, why doesn't she love me? How can she not know who I am? She knows my brother. My brother, it doesn't have anything to do with her, you know, and so I was really offended. I took it real personal. But I remember for like about 2 weeks, I just bawled about it. And I remember screaming out one day, I never want anyone to feel that pain. And then it's kind of amazing the work we're both doing, you know, how the dots kind of connect to things. And you think our paths aren't all that driven, but it's pretty interesting when we look back at our history and the impact certain things have had on us over time. Now, home instead, you know, really sees the prevalence of Alzheimer's and all the other dementias out there. What is their viewpoint and what are their goals in terms of looking at this? Because this has to be hitting you guys fast and strong with the care that you give people.
It most certainly is. We're seeing that about 2/3 of the individuals that we're serving have some sort of cognitive impairment, whether it's MCI all the way through to Alzheimer's disease, Lewy body dementia. So we see multiple types of dementia in the clients that we serve. And so as a network-wide organization, Home Instead is in 12 countries. We have just over 1,200 franchise offices across the U.S. So we're in the homes of so many individuals, seeing families across the globe struggling with the issues of caring for a loved one with Alzheimer's or other types of dementia. And so we've really made a commitment to Alzheimer's and dementia in 3 different ways. So not only do we provide much needed care and support through our home care services across the globe, we also are a thought leader in the space. We know that, just like you're doing here on the podcast, more and more people need to know about the resources and the support out there. People need individuals to speak up on their behalf for better care and support and resources, not only in the United States, but across the globe. So we're really committed in the thought leadership capacity and also in the free resources that we offer. We know that not everyone has access to care, whether they live in a rural part of the country or maybe can't otherwise afford it, but we can offer free resources and we do that online. So we do have a big commitment to Alzheimer's and dementia care in those kind of 3 areas.
Well, that's huge. I mean, it's fantastic because, you know, I think a lot of people don't know how big Home Instead is. You know, I think a lot of people think, well, they're in my country or they're in my state.
Mm-hmm.
And you kind of think in that sense. But when you're out there in that international base and then really seeing that, man, it's not much different no matter where you go, because I know that that's a question that people have. And then in terms of being a thought leader and really looking kind of from that high elevation down of what are the needs and what are the different ways that we can approach that, and then to be able to understand that not everybody can afford services, but they still need to be connected to those resources. So kudos to you guys, because those are 3 big major areas of need.
Really see it as not only an honor to be able to be a thought leader and an advocate, but we feel a duty and a responsibility to those that we serve and the millions of people who are dealing with a diagnosis or the symptoms of Alzheimer's or another type of dementia. So it's a big part of who we are as a company, and whether we're serving older adults in rural Kansas or in China, the struggles, again, are just universal in a lot of ways. And so if we can bring our collaborative knowledge across our markets to help the greater good, we want to do that.
Can we go a little bit deeper in terms of how your company supports individuals living with dementia and their families and care partners within the services that you provide? Because maybe breaking these down even a little bit more to top couple of things that you provide in each area that you're involved in.
I would be happy to. So when it comes to the care that we provide, we generally provide care in the home. So whether that's a residential setting or a community memory care facility, assisted living facility, we go to the individual. So we provide highly personalized care, and we do have a specific Alzheimer's and dementia training program for our caregivers. So they learn about the disease itself and ways to best manage the behaviors that result from Alzheimer's and other dementias. And we teach them strategies to help enhance and improve their quality of life. And so we do that through engaging them in meaningful activities, again, really personalizing that care to meet the individual where they're at, but also enhance their independence, because we know that that's something that's so important to people of all ages, no matter the age that they're diagnosed with Alzheimer's or dementia or any chronic condition, really, is that sense of independence. So that kind of is a little bit about the care and support that we provide. And then we also, in terms of our thought leadership, I have a slide here that shows you just all the different Alzheimer's related organizations we're a part of, and that we have leadership roles within, and that we're working together with to move the needle forward in the Alzheimer's and dementia space. So some of them look familiar, like, the Alzheimer's Association. We're also part of women's movements, Women Against Alzheimer's, Women's Brain Health Initiative, because we know women are impacted in greater numbers, not only with those who have the disease, but also those caring for those with the disease. So we have a lot of our focus in those areas because of the prevalence. And then even the World Economic Forum, which you might not think that could be a way to support those living with Alzheimer's and other dementias, but caregiving and senior related issues are really coming to the top of the most pertinent issues that are facing countries across the world in an economic way. And so we're taking a leadership stance there too. So that's just a kind of a quick snapshot of how we're impacting in the thought leadership space. But then when it comes to our free resources, that's where I get most excited. That's where I spend a lot of my time, and my role is supporting caregivers, and whether that's someone caring for a loved one with dementia or just general caregiving. And so we have various websites that we have available to the public for free. So I just did a quick screenshot of our Help for Alzheimer's Families website. And so you can see this here. On this website, we have a free family caregiver training online. So we've taken what we teach our caregivers, our professional caregivers, and pretty much made it available to family caregivers so they can better understand, my loved one has this diagnosis. What is Alzheimer's disease? What is dementia? What am I going to expect, or what can I expect to happen to my loved one as they go through this disease? And then some tips and tools, resources to help them along the way. So I love that free resource. And then I also do monthly live chats, which are really fun. I connect with an expert out in the field on a various topic, and then we just dive in and discuss it, and then we take live questions from our audience that's tuning in to us. And so we answer questions live and on the internet. So it's, again, open access and a great tool. And then there's some other great features of the website. We do a weekly email on various topics. And then you can also apply for a grant program, which I'll tell you guys all a little bit more about in just a little bit. And then we also have an app that you can download for free. And I have a little snapshot of it here. But this app is great. Once you download it from your Google Play or Apple Store, you can type in any situation that you or your loved one is struggling with. Let's say it's it's bathing or evening, late afternoon agitation, those types of things. You just type those in and lots of tips and tools are sent right to your fingertips. So again, some great resources that are free and available to everyone. And again, we were talking earlier about sometimes it's hard to know where to go for help and support. So this website, helpforalzheimersfamilies.com, is a great tool.
Well, that's a wonderful, the app, I would think people would just, I mean, everybody's got their phone, in their hand, in their purse, in their pocket, right on them all the time. So that's got to be just a huge resource for people, because again, a lot of times you're carrying all different types of different things, or you're trying to physically maybe assist somebody, so you can't be loaded down with resource books and things like that. It's a nice, easy thing for people to share and be able to access. So that's great. And I like that you're doing the chats, including families, where you're interviewing the experts and having that dialogue with people, helping them out. That's a wonderful resource as well. So thank you for sharing those things with us, and having the slides just helps, to be able to see exactly what it is you're talking about there. We know that, time away for caring situation, we call it respite, is really important. And I know a lot of families out there don't even know what respite is until they hear it from somebody else, and it has to be explained. Can you tell us why respite, or getting some time away to care for oneself when caring for another, is so important?
You're right. So many people don't really understand what respite is. And there's a great analogy out there, and I don't know who started it. I've heard it in multiple settings, but when you're on an airplane, they say you have to put your oxygen mask on first before assisting the person next to you. And that really applies to the caregiving situation. You have to take care of yourself so that you can continue to provide care to your loved one. So the term respite is really just kind of taking a rest from the caregiving situation, whether it's for 15 minutes or an entire week. It really depends on the situation, how much time you can get away, but taking those little moments for extended periods of time to recharge your batteries. You wouldn't expect your cell phone to continue working if you didn't recharge it every night. So the same thing goes for caregivers. We need to recharge our batteries before we can go on to continue providing care and support to our loved one. And people often wonder, where do I turn for respite? And I like to tell people, you have to kind of tap into that network around you. So it could be a family member or a friend or even a neighbor stopping over for a short period of time so that you can get away and make sure that you're caring for your own needs. We know that especially when it comes to the health of caregivers, they're first to make sure their loved one gets to all of their appointments, but often put their own on the back burner. So it might be taking an hour or two away from the caregiving situation to go to their own annual physical, just to make sure that they're staying healthy and on top of their own health care needs. But respite could also be found in maybe your local faith-based community or volunteer program within your community. The area agencies on aging are also a great resource that can help connect you oftentimes to a respite resource center. These are some areas to look at for respite care. Of course, you can hire a professional home care company like Home Instead. We provide a lot of respite care. It's a big part of what we do, filling in the schedule when family can't be there or making sure that the family can get time away. But then there's also some care communities who have a respite program. So let's say you do have a vacation you want to go on, or a family function that you need to attend, and you would like your loved one to stay in a community for a couple of nights. Some communities do have that more extended respite option. So there are options out there for respite. Sometimes you have to get creative and tap into kind of those unusual suspects in your social circles, but having that opportunity to get away, gosh, it's so important. And I'm sure, Lori, you talk to many caregivers who feel like maybe they don't even have time to take a nap or to take a shower, but we know that those moments away can be so helpful, again, to recharge those batteries.
Yeah, it's interesting when you mentioned about sleep. I've had a few people who have hired a company like Home Instead to come in and just so that they could nap. They were still going to be in the house, but they just needed to sleep. And so I've seen, and there's so many different ways. I mean, there's adult day programs that people can tap into, though a lot of people don't like the name adult day. Either they'd like some other type of setting or name for those. People are tossing that around. I've seen one woman, her story was hilarious. She would go to church every week and her friends would say, you know, what can we do for you? What can we do for you? And she would always say, oh, nothing. I've got it under control. I've got it under control. And one day her little friend pulled her aside and said, you don't have it under control. You can blame me. You don't have it under control. She went and she bought her a set of note cards and she says, I'm going to give these to you. And she says, I want you to go home and write down all the things you could use help with. If it's somebody getting your mail, if it's someone cutting the grass, if it's someone coming to stay with your husband so you can get your hair done, I don't care what it is, but I want every single card filled out when we come to church next Sunday. So they go to church the next Sunday. And one of the friends came up and said, you know, what could I help you with? And instead of saying no and pushing people away, she just reached into her purse, didn't know what it was, and she handed them a card.
Oh, wow.
And she realized, you know, after talking with her friend about this, that, you know, how much she herself loved caring for others and being able to help out. And sometimes I think care partners don't realize that they're not allowing others to feel good about helping out someone else. You know, we're taking that opportunity away. So I think so often we look at it as a burden, but for many, it's truly a gift. They want to be there for their friends and for their family and to support. And companies like Home Instead are prepared to step in and kind of, you know, be that family for them when they need that extra support, when it's not there in other ways. And it can just be a lifesaver, because we both know so often a care partner can end up having major health issues prior to the person with dementia, and then that really upsets the apple cart. Now you're in total crisis and having to change things around, and that's what Home Instead is really trying to avoid for people. It's kind of keeping that peace. Can you talk a little bit about Hilarity for Charity? Because I know you're doing some work with them as well, I believe.
Yes, yeah, I have a slide just to give you guys a little overview of this grant program we've created. So we know that, you know, respite can be so beneficial, but we know that not everyone can afford respite care. And so those who are caring for a loved one with Alzheimer's and dementia had the opportunity to apply for a grant through the Hilarity for Charity Respite Grant Program. And so we partnered with them, gosh, I think it's been over 5 years now, and we've been able to help out so many families through this grant program. It's been really neat to see the positive impact that, you know, these hours of care can provide for that family caregiver, gives them the energy to keep going. So we've granted, you know, over 255,000 hours worth of care and support for these family caregivers. And it is open to the public to apply for a grant. We do give them out on a regular basis, so it's not an immediate kind of emergency grant situation. It does take a little time for the application process to take place, but anyone can apply at helpforalzheimersfamilies.com. And then on that grant application, we ask you to tell us about your caregiving situation. Really give us a description of a look into your day-to-day life as a caregiver, and that helps our grant team really take a look at those applications and make sure that help is getting to those who are really in the most need. So would encourage anyone to apply. It's again, it's been so fun and to get to call these applicants and say, you've received your grant, and just the sigh of relief that you can hear over the phone even. We've done a couple in-person interviews, and one woman said, this grant literally saved my life. I felt like as a caregiver, I just was at my wit's end. I felt like it was going to take me before it took my loved one. And so this program really was that kind of lifesaver. So again, if you want to apply, we encourage you to do that at helpforalzheimersfamilies.com.
Oh, that is wonderful. Now, you guys also have done some things in terms of educating businesses out there too, if I'm not mistaken.
We have an Alzheimer's friendly business program, which has been a great way to create more of that dementia friendly community. We know that this disease can be very isolating, not only for the individual living with Alzheimer's and dementia, but also their care partner, especially if the individual can't really leave the house, or if the care partner is nervous about taking their loved one out in public because they're afraid that their loved one might do something out of the ordinary that people won't understand. So we helped develop this training. Any business can go online. We have it available at helpforalzheimersfamilies.com. I think there's also a alzheimersfriendlybusiness.com URL that will also link there. But the premise of it, it's a basic training, but just kind of helps businesses understand what is Alzheimer's disease, what are some of the common symptoms that result or behaviors that result because of Alzheimer's or dementia. That way, if they see an individual in their place of business, whether it's, I know my dentist is Alzheimer's friendly business certified, or whether it's a bank or a grocery store or a restaurant, that they're just a little more compassionate and understanding, and take a little extra time with that customer to make them feel more welcome in that business establishment. So it's been fun to watch businesses go through this training. Even some first responders have really benefited from the Alzheimer's friendly business training. So if you have a business out there or want to learn more, we encourage you to check it out.
Yeah, it's such a huge movement, getting people to understand this touches more than just the medical model. And I think sometimes people think when they've got a disease, well, I have to, it just affects our family, and then we're in this medical model. But dementia, any form of it, is really a societal issue. It's one that touches so many people. Your family, your friends, your colleagues, your neighbors. People at the gas station, the grocery store, and most have been touched by it. One person every 3 seconds develops some form of dementia around the world, and people are shocked when they hear that statistic. And that's really about the only one I use. But when you start having the conversation, when you make it comfortable, you will be surprised. And this has to come out of the closet. It has to come out of your house. And we have to help people not be embarrassed or ashamed of a medical condition, because that's the only way that we're going to be able to create more services and products and tools to help you out. And so those conversations have to be had. And Home Instead's done a great job, providing you with a lot of free things that you should take advantage of. Don't hesitate in terms of getting involved and having that conversation. I did want to have you talk a little bit more in depth about Home Instead senior care, and if I wanted that for a loved one of mine, what would be the process and what kinds of things can you provide? Because I don't think everybody understands really what home care is, and there's different levels of it. So if you can explain Home Instead Senior Care's network and what that involves, I think that would be really helpful for our audience.
I would be happy to. You're right. I encounter a lot of people who understand what home health is, but they don't always understand what home care is. And the two services actually can be often very complementary of one another. So at Home Instead Senior Care, again, we provide that highly personalized care at home. And so the process really to get signed up for services, or even to just have a free care consultation, would be to contact your local office. So we have homeinstead.com where you can do a zip code search for your local home instead office. We have about 650 in the US, so there's likely one near you or wherever your loved one is living. And so we come out and we do a care consultation. So what that entails is really just sitting down with the individual living with dementia and their family members to discuss what are their care needs. And it might be something as simple as companionship, or spending time with that individual, engaging them in meaningful activities while their loved one gets away for respite. Could be a couple days a week, but we can also kind of increase our services as the needs of the individual and the family grow. So we can also help around the house with, cooking meals, light housekeeping. We can help with those medication reminders. We know medication management is so important, and if there's not a routine medication regimen, then sometimes more health conditions can take place or more health incidences. So we can help with that. But then also, we know as the disease progresses, it impacts individuals' ability to provide for their activities of daily living. So bathing, grooming, restroom, needs, that sort of thing. So our trained caregivers, they provide personal care services. So they can help with the shower, or they can help with the grooming process, the dressing process, and even help with some of those incontinence or restroom needs. So we kind of have a range of services. And again, we really tailor it to what the individual needs. And we meet them where they're at in the disease, but can also grow with them. So how we're different than, a home health care is we don't have a physical therapist or an occupational therapist. And some of those more skilled nursing tasks, that's what a home health care company would do. But we can, again, partner with those home health companies to, again, customize that care. And it can be as little as, 3 or 4 hours a day, up to 24/7, 365 if needed. But again, we can grow with the individual and even provide these services after they've transitioned to a memory care facility. So we know that having that consistency can help with the transition, and a lot of times families will keep us on, even if it's just a few days a week, to help with that transition. So we can really be there for them, as they progress through the disease. So we can even help with that end-of-life care and is on hospice. We can support that hospice team and that individual through the end of life. So it really, again, just spans from a little bit of help all the way to full support.
That is nice when it comes to the transition, and it's really quite smart to carry that over just for that comfort level and that routine and extra set of eyes, because I know there's always a lot of angst when somebody is placed into a community or hospital or whatever it might be. One question, because a lot of times I know when I'm talking with people, they think, well, they have to, if I hire them, they're just going to do stuff at my home. Can your people take them out to a movie or, go to the park or go for walks and things like that? Or is it just in the house itself type opportunities?
If the family gives us the okay. And actually that's, a great way for the individual living with dementia, again, to get back out in the community or maintain some of their favorite activities. One of my favorite stories is a gentleman loved golf, but he really physically couldn't play golf anymore. So his caregiver would take him to the driving range, and they would get a soda, and they'd sit there and they'd watch and they'd critique the various golfers who were hitting balls at the driving range. So again, it goes back to the kind of those meaningful opportunities for engagement, really getting to know the individual, their preferences, what they love doing, their hobbies, and making sure that those are incorporated into their day-to-day life. So whether it's going to a museum or just going to a park and getting some sunshine, seeing people, little kiddos running around, that can do a lot in terms of lifting spirits and, again, continuing to engage them in their community, which we know, again, is so important.
Oh, absolutely. And I'm glad I asked that, because that is a question that I get from a lot of people not understanding. And, it's just a matter of asking. And you guys seem to be so person-centered in terms of what you're doing and relationship-based, really kind of getting at the heart of of what a family needs and wants, to make this journey a little bit easier for everyone. Is there anything that we haven't covered? Do you want to maybe highlight some of your upcoming programs that you have?
We do have a great Facebook community. I'd love to highlight that. So I did pull up again a screenshot. We have over 270 followers on our Facebook page. It's very active. We always put questions out there and get a lot of great feedback. And we also stream our live chats on Facebook Live. It's something new we've been trying, and we've gotten a lot of great response from that. So that's one way you can connect with other caregivers. And one of my favorite parts about our email list, which I mentioned earlier, you can sign up for that on our helpforalzheimersfamilies.com website, is that we'll put a scenario out that came from one of our Facebook followers or one of our email participants. Maybe it's a situation they're dealing with. And we ask fellow caregivers, what are your tips and suggestions for this caregiver? And we found the most remarkable suggestions come from other caregivers in their community. So it's a great way to connect with other caregivers, again, through our Facebook group. And it's Remember for Alzheimer's is the name of our Facebook group. So you can just search that on Facebook. And then we know wandering can be something that some individuals experience with Alzheimer's or another type of dementia, and that can be a very scary situation for family members. So we created the Missing Senior Network, which is a resource where you can go in and create a profile for your loved one, and then you can type in all the contacts. So in case of an emergency, if your loved one wanders, you can log into the website and send one message out to all of the contacts in your contact profile. So that saves you a lot of time calling or sending text messages. And it can also put an alert out on your Facebook page if that's something, a community you engage with, again, to help find those individuals who might have wandered. We know time is of the essence, so that tool has also been really helpful. And there's a lot of great resources. We also have a website called caregiverstress.com, in addition to our helpforalzheimersfamilies.com. And caregiverstress.com has, more general caregiving topics that are really pertinent but can apply to those who are caring for a loved one with Alzheimer's or dementia, such as home safety. We know that that's a big topic, and managing that caregiver stress that so many are dealing with. So those are a few of our other resources that we have out there. But what I love about Home Instead is we're always putting out new public education programs. We just did one called Home Your Own Way, and it was all about, is your home set up for you to age in? What are some things you can do kind of on the preventative side of things to prepare your home for the way you want to age? So we're always coming out with new helpful tools and resources on those various websites.
I love that title, Home Your Own Way. That is great. And on this slide here, you've got the Missing Senior Network, but you also have some information on preventing wandering. And, so many people will say, well, my person doesn't wander. You don't know if they wander till they wander. Mm-hmm. And that can switch on a dime. So having that information already logged in, ready to go, because when someone goes missing, you're frantic. I mean, you're in the midst of crisis. And if that can all be pre-established information, what a help that can be. Can that hook up at all with the local police at all?
That's a great question. At this point, it does not. I don't believe you can type 911 into your contacts, but I think the beauty of it is you can, call your local authorities and then jump on this website and send one mass message out to your family, friends, neighbors, that sort of thing. So it still helps to minimize the number of communication attempts you have to make to help locate your loved one. So, unfortunately, I don't believe that it does connect to your local law enforcement, but again, it cuts down on that time.
Oh, definitely. And one thing that I learned in working with our dementia-friendly community here in Roseville, Minnesota, when we had the police and EMTs and fire out for a panel one time, and I didn't know this until they told us this. They said, anybody can call 911, non-emergency, and register that they have a person living in their house with dementia, what their name is, what they like to be called, note which direction they typically like to scoot, if they're a lefty or a righty when they turn to go out the door and walk. And you can have all their basic height and weight. You can give them information on their doctors, all kinds of different stuff they'll take, as long as there's not a crisis going on in the community, and there's no charge for that. But what they said was it really helps if an officer or fire is called to the house, they know what to expect. And a lot of times people can give great helpful hints to calm somebody down just by using, if it's a husband who's upset, and say, Mary's going to be home shortly, we've been in contact with her, using those names or nicknames can be really, really reassuring for people. Or if music works to help calm them down, you'd say, because they can pull out their phone too and play a song and help calm somebody down. So all those little things, it is just another way to be prepared just in case, because we never know when an emergency, could happen. And that emergency may be the person with dementia, or it could be the care partner themselves. Let's say you get in a car accident. Mm-hmm. And I think so often the care partners are so focused on who they're caring for, they forget about what if something happens to me, and having a backup plan for that as well. Even just having those little cards. I don't know if you guys do this or not, but a lot of places have the card saying, I have dementia, please be patient with me. Or there'll be a card saying, I'm with somebody with dementia, please be patient with us. But what we did with those cards in our Roseville dementia group was on the back side, we put contact information. Because, that's nice, but if someone's in a car accident or someone has a heart attack or a stroke, you still don't know who to contact. And so we just added that on the back, and that's been a really great resource for people just to carry in their purse or wallet, or put in their glove compartment with their insurance papers, whatever.
I really like that suggestion. I have seen those cards, and we do reference them in some of our materials, but I like adding that contact information to the back. You're absolutely right. If something were to happen to them, the care partner, it'd be great to have that contact information. It sounds like you have such a great dementia-friendly community happening in your area. I love hearing all these tips from the work you're doing. It sounds great.
Yeah, they've even started what they call memory minders. They're working with the libraries. And so our libraries in Ramsey County have kits for people. They have kits for Alzheimer's and dementia. Basically, they have them for early, mid, and late stages. And they have an engagement piece, an education piece, and some other things in between there. And then now they've just done one, I think, for Lewy body and FTD, and now they've developed one for children, so that children can understand, maybe what's going on if it's a parent or a grandparent or an aunt or an uncle, education for them. And so those have been really cool too to see, and they're starting to pick up and spread around the country as well. Well, actually outside even the country with that. So the sky is the limit. It just, if you believe you can make a difference, you will. And I think it's really thinking outside the box of what, what's been provided so far. I think those are the cutting edge things that are truly starting to grow, because people know that our government, doesn't have a whole lot of money, and our medical processes aren't where we think they should be. And so that means individuals have to step up and get more involved in businesses like Home Instead, take that thought leader role and get creative. And it's amazing what all you guys are doing. I thank you so much for coming on the show and sharing the work and the massive-ness. You've gone outside your box of what people would expect. They're like, well, I'm going to hire somebody to help me out, but you are helping in so many other levels, and in making it accessible for people and affordable is huge. it's absolutely huge. And so kudos to you guys.
Well, thank you, and thanks for again letting us share these resources and opportunities. Again, it's just something we feel so passionately about, is increasing the world's capacity to care, because we know until there's a cure, there has to be good quality care, because so many people are living with this disease. So we need to help people within family units provide better care to their loved ones, and then in the professional care industry, raising the bar. So, that's what we're about. And at the end of the day, we just want to enhance those lives of those that we come in contact with each and every day.
Well, I love, like I said, what you're doing. When I switched careers, I basically made a commitment that I couldn't work in a broken system. And that's really how Alzheimer Speaks was created, was just trying to think out of the box and do things a little bit differently. And I see that you guys are right there in terms of how you're delivering services. Again, people can go to homeinstead.com. That's their main website. You can also go to helpforalzheimersfamilies.com. And as you can see on the screen, you can go to missingseniornetwork.com and also preventwandering.com. And then, Lakeland, you had also mentioned, I think it was caregiverstress.com.
Yes.
And so that is fantastic. And if you want to reach out to Lakeland, her information is on the website, but it's Lakeland, Lakelyn, Hogan, Hogan, at Home Instead Inc. That's INC.com. And again, I thank you so much for being with us. This has just been a great conversation, and I know our audience will be thrilled to learn all these new resources that you have.
Well, thank you so much, and thanks again for having me, and for all the work that you do in the Alzheimer's and dementia space. I've been very just impressed with all the work and the progress that you're making. And you're right, everyone can make a difference, and so you definitely are doing that. So thank you again, and I hope that you have a wonderful day.
You too. Bye now.
Bye.